Welcome to yet another edition of Lockdown Conversations. My name is Phillip Williams, and we're here on Mega Networks. And we have a special guest with us today, and we're talking about everything about the mouth, dental hygiene. We have Dr. Jessica in the house. Ladies and gentlemen, help me welcome Dr. Jessica. How are you doing, Doc?
I'm doing well. And how about yourself?
I am good. I'm always nervous when I go to the dentist, so I'm a little nervous now. Well, why
many patients are. Many can attest to that.
Yeah, but why? Why are we nervous when we get to the dentist?
For many people, they've had very bad past experiences from their childhood visiting the dentist, or even as adults. There's that fear instilled into them that the only thing that we do is pull out teeth, and with a lot of pain. Yeah. Most people have that really, really, really big fear of coming to the dentist and sitting in the dental chair.
How often are we supposed to visit the dentist?
Routinely, it is advised to visit at least twice a year, so every 6 months to do a dental checkup. However, currently, because of the COVID-19 pandemic, we're advising the general public that they should hold off, avoid coming to the dentist for regular checkups at this time, and to only visit the dentist if there is an emergency in terms of having extreme dental pain, if you see an abscess or there's swelling in your mouth or outside of the face, or if you would have had some form of accident causing injury to the tooth or face, particularly the mouth, or if you see bleeding coming from the mouth. So if there's no pain, shouldn't visit the dentist at this time.
What should we do for pain? What is recommended? Should we use clove? You know, if you got a cavity, you take a clove and you put it in.
So many people, it is a home remedy, the spice clove. Many people truly believe in it, that it alleviates pain. Now, it's not really the spice that is able to alleviate the pain, but it's an ingredient in the clove, which is called eugenol. So that little ingredient, it has antibacterial and analgesic properties, which basically means that it helps to fight bacteria that might be present in the cavity and also to stop pain. So it can be used, although there isn't much scientific proof and studies behind it. And just those properties in the clove can help.
And I know as doctors, you're not supposed to necessarily preach anything apart from the science.
Yeah.
All right. So tell me, let's talk about you a little bit. Why dentistry? What was the romance about this?
The romance. Well, I always knew as a child that I wanted to help people. And actually from looking at what has occurred in Guyana, not many people have the access to dentists across Guyana. Wherever the area they may come from, especially rural communities, it's very hard to get to a dentist in most areas. So because I knew there was a general need for a dentistry in Guyana, it gravitated me towards wanting to pursue the career.
I know you told me earlier that you're working with the children now at the dental school. Is it easier to work with children or is it easier to work with adults?
Well, it has its challenges working with children, because as you can imagine, just as adults, there are many children with a lot of fear, great phobia of dentists. So there are times when we get bitten or scratched or spat at. So there are the challenges. Yeah. But from being in the pediatric department for the past 2 years, what I have found is that each child is different and unique, and it's really important to try to provide that care that we can and instill in them the knowledge and education of taking care of their teeth at such a young age, so that as they grow older, they'd be able to make better choices and better habits to take better care of their teeth. So we won't end up with having as many extractions to do when they're adults. That has been a problem in Guyana, where most people believe that if there's something wrong with their teeth, that they should just pull it out. So by educating the children at an earlier age, the ways to properly brush, what they should eat, and what they can do to save their teeth to avoid extractions. It's good in the long run.
I know here culturally we say when you wake up in the morning, you brush teeth, and before you go to bed, you brush your teeth. That's 2 times. That's twice a day. Do we brush our teeth more often than that's the 2 days, the 2 times per day?
I know for most people, it would be quite difficult, especially if you're at work or if you're on the go, to be able to have that toothbrush with you to brush after every single meal, or even to just remember to do that. It's really hard for people. So we advise at least 2 times a day, in the morning after breakfast and before bed. That's after your last meal.
So let me hear that again. In the morning after breakfast?
Yes, after breakfast.
Mm-hmm.
After breakfast and before bed after your last meal.
So it's not before breakfast in the morning?
Well, for some people, they do it before breakfast. It's just making sure that you brush your teeth before breakfast. Before the start of the day.
Okay, cool.
Yes.
So do you think now that we're in this lockdown situation and our children are home and they want snacks all the time, they want food all the time, would you think it's an opportunity for us to kind of teach them to brush, to increase the frequency of them brushing their teeth now that they're home?
I know that, especially at this time, many children might want to eat more sweets, but as parents, it's really important that you try to be very stern with them to limit the amount of sugars that they consume. Because if they do consume a lot of sugar, they're having too much sugary snacks and drinks and a lot of sticky foods, it can cause them to develop cavities very, very quickly. So it's highly advised that at this time that you monitor what they eat. Be very mindful of their diet, try to reduce the amount of sugars as much as you can so that they don't develop cavities at this time. And also, yes, to encourage brushing and properly brushing, especially if your child is below the age of 6, where they don't have the proper technique, don't know to brush on their own as yet. You should be there with them, show them how to brush, then look over them to make sure that they're brushing the right way.
Now let's talk about the adults. Is flossing a thing?
Yes, flossing is very, very important. I don't know if many people know what floss is. So dental floss, as we call it, is a special thread that is used to clean between teeth. Now, for many people, they believe that just brushing the teeth is enough. But when you do brush your teeth, the toothbrush isn't able to get between those tight spaces between your teeth. The bristles don't ever get to go between those areas. So what happens with time, when food is left between those very, very tight spaces, you can develop cavities or decay between those areas. So to avoid that happen, dental floss is just a special thread that fits between the spaces of the teeth. So we advise that it's done at least, again, twice daily, or preferably after every meal, to remove the food or any buildup that can happen between the teeth. So that's why it's so important, and we recommend it highly.
What do you think on a personal level that this period is teaching us as regular citizens and yourself and your colleagues as healthcare providers?
It's definitely teaching us that we have to be a lot more careful and clean in what we do, because not many persons were very hygienic, to put it in simple terms, that we would often take it for granted, washing our hands as often as we need to right now, and cleaning surfaces frequently. Many times I know for many people, they didn't have that practice for themselves. Now for dentists, we were already trained to some extent dealing with the transmission of diseases while we were doing our practices, more so bloodborne diseases to protect ourselves against it, but we never had this airborne transmission as much as we're having to deal with now. So I know that for not only the medical fraternity, but for dentists, it definitely would not ever be the same again, because we would always from now on have to be mindful that while working on a patient, because we're in such a close proximity to them, that we're at highest risk of becoming infected by one of these diseases, whether it's the COVID-19 or any other disease, which we don't want to appear.
Right.
We don't know what will happen down the road.
Well, Dr. Jessica, thank you for your time. This was very informative and reassuring for those of us who know already. For those of us who didn't know, it's important to floss. It's important to brush your teeth at least twice, ideally after every meal. It's important that our children, we monitor the amount of sweet and sticky foods that our toddlers and our children would eat. Ensure that
And drinks. And
sugary juices.
And the sweet drinks.
And the sweet drinks.
And before I go, I just want to say to remember that at this time, you're only to visit the dentist if there's a dental emergency, if there's extreme pain or swelling or any trauma that would have occurred.
Apart from that, stay home.
Yes. Yes. No routine checkups where there's no pain at this time.
Okay. Thanks for your time, Jessica. Have a good one.
You too. Thanks for having me.
No problem.